I'm Miranda Ibrahim. I'm Dr. Ibrahim's daughter. Thank you for watching the videos and subscribing. I just wanted to tell everybody that recently my dad took the orthopedic board recertification exam and he scored in the 100th percentile. While 10 years ago when he took it, he scored in the 99th. So I just wanted him to share with you guys some of his study tips that took him from being in the 99th to the 100th. To prepare you for taking an exam, we need to touch on these 3 items: preparation, time management, and making a schedule. Everybody gets nervous when it comes time to take a test. Perhaps just thinking about the test makes people more nervous than the test itself. In preparation for the exam, you should study past exams, know your strengths and weaknesses, know the test format, key concepts, and study on a regular basis. When you study past exams, you should give yourself adequate time to prepare. You may want to repeat studying past exams. Practice, practice, practice. Practice relevant questions. You should also prepare and practice the test under time conditions, adverse conditions, and stressful conditions. Try to simulate the worst possible condition that you could be involved in on the test day. This will help you build confidence and mental stamina. You should recreate the test environment as closely as possible. Practice past exams and quizzes. Quiz yourself and use multiple sources. There are 5 levels of cognitive domain: recognition, comprehension, application, analysis, synthesis. Recognition is identifying the important information. Comprehension is having excellent understanding of the concepts. Application is utilizing the information being read in the correct way. Analysis is breaking down the concepts in order to gain a better understanding. The concept is being studied but not immediately understood. Synthesis is the use of intellect in looking at the concepts from another way. Information is then understood. Practice will take the 5 levels down to only 3. You see it, you kill it. You need to have different keys to open different doors. Be confident and tell yourself things like, "I have seen this door before, and I know which key will open it." Practice speed. Check your initial speed when answering exam questions and strive to cut that time in half. Anticipate, anticipate, and apply. Discover your weaknesses and strengths. Stay above the mean in all topics. This is how you achieve a good percentile on the exam. The number of questions that are answered correctly above the mean will guarantee a good percentile on the exam. If one category is below the mean, this will wipe out some of the positive scores of other categories. You should understand the test format. Ask yourself, what is the format of the test? Familiarize yourself with the test format so there'll be no surprises. You see it, you kill it. Standardized tests are performance tests. You will need to develop your own personal strategy for these tests. You need to be familiar with the structure and directions ahead of time. You need to be familiar with the sections, types of questions, and time. This will make you focus on the questions themselves. It is important to understand the key knowledge concepts that are commonly tested. You need to know the key concepts. Concepts usually describe important events, features, or tie-related ideas and observations together. These are the items that usually appear on multiple-choice exams. Compile them and study the concepts frequently. The concepts are the basic information. Put the main ideas, information, diagrams, and figures onto a sheet and review this information many times. Create your own flashcards or files using index cards or printing material to study from. No matter how the concepts are presented, they always remain the same, just like this cat. A cat is a cat. Topics that have many concepts, such as slipped capital femoral epiphysis, is a hot topic. You will face multiple questions on this topic. Study on a regular basis. You should study something every day no matter what, even if it's only for about 10 minutes or so. You need to have dedication, commitment, and discipline. Time management. Ask yourself, how much time do I need? When do I begin? Do I need a structured plan? Do I need 6 months? Maybe 12? Multiple question exams require a long time devoted to studying. This is not a short-term thing. Avoid cramming to decrease your stress level. Multiple exam questions focus on the details. You cannot retain many details effectively in short-term memory. You learn a little bit every day and allow plenty of time for repeated review that will build to a very reliable long-term memory. Start now and do not delay. It can be very hard to begin studying. Have a written and structured plan for studying. Balance competing factors such as work, personal time, family time, weekends, holidays, or vacations. It's important to make a schedule. Stay with the schedule. Try to finish ahead of the schedule. Use the salami technique. A thin slice every day so you can digest it and enjoy it. If you focus on the important concepts and study at least a little bit every day, then you will be complete. When it comes time to taking the actual test, try to have a test day strategy and a memorization plan for things you could forget, such as charts, diagrams, and numbers. During the test, be aware of double and triple jumps. Be aware of complex questions. Read the last sentence first. Read the body or the stem of the question next. The body contains the important information. Next, look at the images, videos, or diagrams associated with the question. Now it's time to predict the answer. Dig for the gold and select. If you cannot select the answer right away, then eliminate the incorrect options. Eliminate the incorrect options and select the answer using your best guess. If you're guessing and not sure of the answer, choose the numerical answer at the middle of the range and flag it to come back to it later. If you practice with old exams, you will have plenty of time to go over some of the harder questions again.
This video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.